talk to me a little bit about specifically monkeypox. How concerned is UNC that this could be an issue?
Well, UNC is always concerned about anything that potentially impacts the health and well-being of our students, faculty, and staff here on our campus community, as well as the larger community that we serve and support here in Greeley and Northern Colorado. So there's always a concern, but we also are aware that MPV or monkeypox is less severe in terms of its threat and risk than COVID-19 has been. And we really have confidence in our ability to respond through education and communication to our community in support of prevention and awareness.
Talk to me some about that education and communication. What kinds of efforts have you put forward to try to raise awareness in the community?
Sure. We've done campus-wide communication, as we have with COVID-19 over the past couple of years. And so we've been messaging to help our students, faculty, and staff have an awareness of the risk related to MPV. And that comes through emails to campus as well as postings across campus and locations where they'll be able to see that information. And we try to communicate that among other topics to our campus regularly. We've also provided a page on our website that provides a lot of information about MPV, as well as links to CDC and Colorado Department of Public Health and Environment information that would be pertinent for their awareness and understanding of the risks and prevention methods.
Help me understand if what kind of services might be available through student health services. Is there testing, vaccinations available through the clinics?
Yeah, so right now our student health center is ready and able to provide testing to our campus community, and are prepared with the protocols necessary to make that testing available to that community and to provide it to the labs in the state of Colorado that process that testing. And also we've always worked toward making vaccines available on our campus. And in this case, we do have actually a vaccination bus from the Colorado Department of Public Health that's available to our campus community and larger community here on campus. And we're making that available. And we'll continue to do so as often as we can, as long as vaccines are available and the bus can be made available to us.
Got it. So is that bus kind of like a mobile clinic that doesn't just do monkeypox vaccinations, but any kind of vaccination that you may need?
That's right. We've had COVID-19 vaccine mobile clinic on campus multiple times, as often as we possibly can over the last year. We've requested and made arrangements with the Colorado Department of Public Health to have a mobile clinic that has the MPV vaccine available as well. And we'll continue to make that available if we can.
You alluded to this at the top, and it's my second to last question for you, sir, is, we've been dealing with a virus and a pandemic for the last, 2 years now. How do you view COVID versus monkeypox in terms of the challenges and the risks?
Well, first, we have the benefit of a heightened awareness of how these issues can affect our campus community via the experience we've had with COVID-19. And that's helped us to really sharpen our capabilities in responding to those issues. So we feel really well prepared due to the experience we've had with COVID-19 to respond to MPV as well and its potential implications for our community. But we also recognize that MPV is not the same virus as COVID-19. The risks are lower and the symptoms of those who do have a positive case are less severe in most cases, and recovery is likely in a matter of weeks without any indication of long-term implications. And so we just want to be sure that we are providing that education and awareness that will minimize the implications for our community and make vaccines available to support those who have high risk, and then to mitigate any concerns that the campus community may have. And so I think we're well prepared and positioned to do that. And I think our concerns about MPV are less severe than we had with COVID-19, and that comes from that depth of experience now, as well as the nature of this particular illness.
Got it, sir. Those are all the questions I have for you. Is there anything I'm missing that you think it's important for us to cover, or anything else that I should know about what UNC is doing?
Yeah, I'd just like to say that, we believe we had an exemplary response to COVID-19 as a campus community, and we really believe that we're well prepared to respond here on behalf of our students, faculty, and staff, and protect them and to serve them in their health and well-being. And that extends beyond just our campus to all of Northern Colorado and the Greeley community especially.
Got it. Sir, thank you so much for your time and for bearing with those slight technical issues. I really appreciate it.